Okay, so I'm going to be doing my IV insertion video. So I'm going to do my quick sweep. So I have, this is the top of my desk, just some old gloves. I'm not going to wear them. They're too small. Old CD, there's nothing, it's just, nothing on there, nothing on here. This is my main desk. So I got obviously my IV arm, my drape towel, my gloves, my alcohol swab. I'm just using an old one because I don't know how many I have in my skills bag. I don't feel like digging through it. My tegaderm, which ripped, but we're going to pretend like it didn't rip. My needle, my tourniquet, or tegaderm, not tourniquet, my bad, for the last one. My tourniquet, my flush, my saline lock, and then my tape. And then there's nothing under here. And then there's nothing down there. And then there's nothing on me that I can use to, and no notes or anything. So the first thing we're going to do is we're going to check our orders and check the chart to see if there's a order to put an IV in. So then we're going to collect my supplies, which I just showed on the camera, wash my hands, and then introduce myself and identify the patient. So, hey there, Bob. My name is Zach. I'm going to be your nurse today. And then ask him, so say, could I get your last name and date of birth? He says, okay, I say, can I get your name and date of birth? He goes, Bob Jones, August 6, 1955. I look at his name band. It works. It checks out. So then what I'm going to do now is I'm going to ask him if he has any allergies to iodine or any other sensitive detergents or cleaning products. He says no. We're all good to go. I'm going to provide for privacy, and then I'm going to explain the procedure. So say, Bob, the doctor wants to give you some IV medications, and we need to put an IV in you. And he goes, okay, sure. So we go, perfect, let's get her going then. So first thing that I'm going to do is I'm going to get my saline lock ready. So I got my flush, make sure that there's no air bubbles in it. And then we're going to connect it to here. Oops. And then I'm just going to flush it, prime it, and flush it through here. Once it's there, I'm just going to clamp this and set it off to the side. Now I'm going to assess his arm and ask him, maybe where does he want it. So obviously we're going to want to choose the non-dominant hand first, as well as looking for any complications. So like a PICC line or a fistula. I guess PICC line already, but like a fistula, if they get dialysis, obviously that arm's going to be restricted, so we're not going to go for that arm. So he goes, I'm going to use this arm. We say perfect. We got our saline lock ready. So now we're going to grab our tourniquet, and we're going to make sure, it's going to be kind of hard because this is pretty light, but I'm going to try to obviously tie it as tight as I can. So we're going to get the tourniquet on him, and we're going to pick a vein that's roughly 6 centimeters, or 6 inches, my bad, 6 inches from where the tourniquet is, so about here. So we're going to obviously tighten it, wrap it around, and then bring that down. So now that the tourniquet's on, I only have 2 minutes to get to obviously poke him. I'm going to check for a pulse. It's still good, so I'm not squeezing it too hard. If the veins aren't like popping out, we can make them go in a dependent so that more blood flow comes to it. We can also tap it, or we can apply a heat pack. So I found my vein, and so now I'm going to put my gloves on. Obviously, we want to have it more distal, so in between the AC and the wrist, just because it'll be more comforting and more comfortable and not as restrictive for the patient. So the veins popping, I got my gloves on. I'm going to grab my alcohol wipe and go in a circular motion for about 20 to 30 seconds. So we're going to start in the inside and go out 20 to 30 seconds. Wait for that. While that's drying, I'm going to grab my needle. I'm going to grab my needle. I can grab it. So I got my needle, it's now dry, so I'm going to take it and make sure that the bevel is up. I'm going to anchor it. I would use my thumb, but it's kind of hard from this angle because it's not really my height. But so we're going to anchor it just with my fingers for the time being. And we're going to insert the IV at about a 15 to 30 degree angle. So put it in. And then once I feel less resistance, I'm going to make it parallel. And then put it about a half centimeter more in. Take the hub, anchor it, put the hub, and take it all the way to the edge. And then I would click the safety pin, but since I may or may not remake this video, I'm not going to push it. So then obviously I would take the needle out, release the tourniquet, I would obviously keep my hand anchored on here, and get my flush ready, connect it to here, and then I would flush it to make sure that it's not infiltrated and that the saline is flushing through the vein. So it's flushing through, it's looking good. So my shirt's gonna be soaked, but whatever. We flush it through. Now we're going to keep my hand anchored. We're gonna grab my tegaderm. It ripped, like I said, so it's gotta be botched. But there's a little opening area, and we're just gonna put that on the hub. So about there. And then we're gonna grab some tape, and we're just going to. And so then we're going to tape it obviously by the hub. And then what we can do also, we can obviously make sure that this is locked again, disconnect it, and then we can fold it upward and then tape this together so that it's a little bit more comfortable for the patient. So obviously it's a lifespan consideration. We may, or if it's an elderly person, we may or may not use the tourniquet just because we may blow the vein. Obviously, we're going to clean up the area, put the needle in the sharps, remove my gloves, give the patient their collet, make sure their bed's low all the way to the ground, making sure that they're comfortable, that they don't need anything, and then documentation. So checking the needle, how many times you poke to them, the gauge, how they felt during it, and any pain that may have occurred.